Last, strength testing in the elbow. Again, just flexion against my hand. Good. And I'll straighten out your elbow against my hand. Good. And that's very good strength in the elbow as well. Moving down to the wrist. Again, we inspect for symmetry, for discoloration, or for deformity. They're both fine. Palpation. Again, we'll palpate the wrist, looking for tenderness, looking for any signs of swelling or effusion. Good. We'll palpate the carpometacarpal joints, which are up here, the metacarpophalangeal joints, which are up here, for any tenderness or swelling, and the PIP, proximal interphalangeal joints, which are up here for tenderness or swelling. Then we do range of motion of the wrist and the hand. So flexion, extension, and ulnar flexion like this, and actually radial flexion is like this, and this is ulnar flexion. Good. And flexion at the MCP joints like this, metacarpophalangeal joints, and extension. Good. And last but not least, make a fist. Good. That's range of motion in the wrist and the hand. Last thing, again, we'll test strength. And to test strength in the wrist and hand, first we'll get you just to push down. Just hold your hand down like this, and don't let me straighten it. Now just make a fist and hold your hand up, and don't let me push it down. Good. Now hold on to my fingers, and don't let them go. Okay, fight back. Good. That's good. Great. And spread your fingers out. Don't let me push them together. Okay. And now take your thumb and your little finger, and don't let me pull my finger out. Good. And that's strength in the wrist and hand. So that's systematically inspection, range of motion, palpation.
There are a couple of special tests that you might do if you're considering carpal tunnel syndrome in your diagnosis. The first one is Tunnel sign, just tapping over the median nerve as it passes through the carpal tunnel. And a positive test in this situation will be if you get the tingling and the distribution of the median nerve, and that's generally on this part of the hand here. The second one would be Phelan's test, where you have the patient put the back surface of their hands together. Okay, keep that together and bend your wrist as much as you can, and just hold it there. Bend it down, just like you have, or just like you are, and just hold it right there. And after a period of 30 to 60 seconds, the patient may experience their symptoms. They may have pain or numbness in the distribution.